Hadden. Yeah, it's a different title there, but I was told to give this, on my email, the same talk as I gave previously, so I apologise if there's any confusion, and apologise if anyone has heard this before. Not sure how that happened. But anyway, I'll talk about multimodal imaging, which of course is the use of one technology to acquire images, more than one technology to acquire images that complement each other. Let's look at photography first. So photography has many uses, one of which is remote diagnosis, for instance in diabetic screening. I also run a virtual multimodal imaging tumour clinic in which I review the images of patients without seeing them to rule out benign lesions such as this nevus, which you can see has no autofluorescence on the fundus autofluorescence and is relatively dark on, no fluid on OCT, and is relatively dark on autofluorescence. And as Grant has mentioned, we have an interest in diabetic photo screening, and we're cooperating with the All India Ophthalmic Society in this regard, and came out with that statement last year after the meeting in Kochi. Of course, photography's changed in recent years, and we now have wide field cameras that have much improved our ability to visualize the periphery and large lesions such as this choroidal melanoma. You can then put different filters on your camera. Adding a red filter can image choroidal lesions better, while red-free photography can highlight red lesions such as hemorrhages and diabetic retinopathy. Many modern cameras, of course, also do fundus autofluorescence, which detects lipofuscin and other fluorophores, and you can also use it to see subretinal fluid, which is visible just next to the optic nerve here in the OCT, but also shows up on the autofluorescence. There are diseases that affect the RPE, such as serpiginous choroiditis, can also be quite easily followed with fundus autofluorescence. And congenital hypertrophy of the retinal pigment epithelium shows up as a very dark lesion on autofluorescence, and on OCT you can see atrophy of the retina and choroid with some increased signal from the RPE. Photography also allows sharing of problem cases. So in the South Pacific, we have a WhatsApp group that doctors from small Pacific Island countries can use to get advice from colleagues in Australia and New Zealand. Also, of course, if we have problems of our own, we can ask other people what they think of things, and vice versa. Serophotography can sometimes even make the diagnosis, such as in this case of uveal melanoma. And of course there's also fluorescein angiography, which I'm sure everyone knows about. So OCT. So I guess in the retina you use OCT in two main ways. One, using a map of a wide area to show, say, generalized thinning from this branch retinal vein occlusion, or you can do it slice by slice to look for very localized pathologies. Some people suggest that using black and white images make it easier to visualize pathology. I'm not really convinced by that. And of course you can use enhanced depth imaging when you do an OCT to visualize the choroid better. And here you can see that you can actually see the over a millimeter thick choroidal melanoma. Many machines, of course, now support OCT angiography, allowing non-invasive visualization of the circulation, such in this case of diabetic retinopathy with some edema and also a bit of ischemia. And we still, of course, use ultrasound, very useful in tumours where you can measure the tumour, you can look for response to treatment, and characterise it by its echogenicity and shape. And of course, it's also useful for imaging the posterior segment if you've got media opacity. So I'll show a few examples Here is a typical choroidal melanoma. So here you can see the classic suspicious features of thickness greater than 2 millimeters, subretinal fluid on the OCT, lipofuscin lighting up on the autofluorescence, and on the ultrasound you can see it's hypoechogenic. Some melanomas can be associated with an inferior serous retinal detachment, which shows up very easily on fundus autofluorescence. And this is an unusual one with a cyst on both ultrasound and OCT. Here's another pigmented tumor. It's a little bit unusual clinically because it's got that exudate around it. But on autofluorescence, you can see that it looks very different from the melanoma I showed before. It's very dark. You can't see any hyperautofluorescence on the tumor itself, which you'd normally see with a melanoma because of lipofuscin. And then when you do the OCT enhanced depth image, it's obviously not necessarily choroidal. Finally, when you do ultrasound, you can see it's also not hypoechoic. In fact, it's somewhat hyperechoic. So this is classic of adenocarcinoma of the RPE. And luckily, in this particular patient, a few years later, we got histology on this eye for other reasons and confirmed that diagnosis. Another lump in the peripheral retina. So when we OCT through this one, we can see a large pigment epithelial detachment. And this makes you think not a tumor, but peripheral exudative hemorrhagic chorioretinopathy. And then you can confirm that on both OCT and photography because you can see that it's starting to go down 3 months later. This is a patient with Sjogren-Larsen syndrome. On fundus photography, all you can really see is probably a few little crystalline deposits. Maybe the foveal reflex doesn't look quite normal. And you can see these crystalline deposits on OCT. But then when you do fundus autofluorescence, you can see there's some more general pathology. A white tumor this time, again in the choroid, again with subretinal fluid on OCT. But then when you do an ultrasound, you can see it's very hyperechoic with acoustic shadowing behind it, typical of an osteoma. Another tumor. This tumors are rather hard to see on the color photos because it's almost the same color as the fundus. Although you can see a large amount of serous leakage and serous retinal detachment inferiorly on fundus autofluorescence. Then when you do almost finished. When you do the ultrasound though, you can see it's very hyperechoic, and this of course is typical of choroidal hemangioma. So, thank you from New Zealand.